In this video, we will demonstrate how to properly set up the Easy Stretch device and how to train a patient on its use. When you arrive, greet the patient and thank them for their service. You'll want to locate the device in an area that allows proper clearance and has access to an electrical outlet. Most people set it up right in front of the TV. Use a GFI tester to ensure that the electrical outlet is properly wired. If the outlet fails this test, be sure and let the patient know by reading the statement on the delivery ticket. Also, have the patient sign the ticket to acknowledge the GFI failure. Once the Easy Stretch is plugged in and set up, it's time to get the patient on the device. Initially, adjust the seat back setting for the patient based on their use of the Easy Stretch at the VA, or approximate based on the patient's size. Move the top T-bar from the Easy Stretch. Ask the patient which knee is affected. In this example, it's the patient's left knee. Have the patient sit sideways on the device with their affected side closest to the seat back. Once they are seated, have the patient swing the non-affected leg over the center post. The patient should then use their hand to guide the affected leg into position. Now insert the T-bar and position it so that it rests on the patient's thigh, but does not push down tightly. Be sure and show the patient the T-bar pull pin so they can make adjustments themselves. Modify the seat back to a comfortable position for the patient. The correct adjustment should position that patient so that the inside of the knee aligns with the bolt of the down tube. Adjust the lower section of the down tube to position the ankle cushions to a spot behind the ankle that is comfortable for the patient. Hand the patient the remote control and instruct them that only they should control the device during use. Have the patient get a feel for the Easy Stretch by briefly pressing the up and down arrows on the remote. Tell the patient that positioning the cushions behind the ankles will allow them to work on the extension of the knee joint. They should continue the stretch only until it becomes uncomfortable, not unbearable. Have the patient press the up arrow until the stretch just becomes uncomfortable and release the button. Then have the patient keep the device in that position for 5 minutes. Explain that if the uncomfortable sensation fades during this time, they should stretch a bit more to keep the joint at maximum range for the full 5 minutes. After 5 minutes, have the patient press the down arrow button until their knee is in an unstretched position. Check on the patient's understanding of the extension stretch by asking them if your instructions have been clear and offering to answer any questions they may have. Do not move on until you feel they have a good understanding of the stretch. Patients can choose to stretch only the affected knee if desired. Have the patient use the remote to position the lower T-bar so that they can comfortably move their ankles behind the ankle cushions. They should continue the stretch only until it becomes uncomfortable, not unbearable. Have the patient press the down arrow until the stretch just becomes uncomfortable and release the button. Then have the patient keep the device in that position for 5 minutes. Again, explain that if the uncomfortable sensation fades during this time, they should stretch a bit more to keep the joint at maximum range for the full 5 minutes. After 5 minutes, have the patient press the up arrow button until the knee is in an unstretched position. Check on the patient's understanding of the flexion stretch by asking them if your instructions have been clear and offering to answer any questions they may have. Do not move on until you feel they have a good understanding of the stretch. Repeat the process for the extension stretch, including the instructions for the patient and the 5-minute hold at maximum range. After 5 minutes, have the patient come to an unstretched position and once again check their understanding of the process before moving on. Now that you've taken the patient completely through one session of stretching, explain the daily stretching protocol that they should follow. Have them use the Easy Stretch 4 to 6 times per day, Each time, they will do a 15-minute stretching session exactly like what they just completed. 5 minutes of extension, 5 minutes of flexion, 5 minutes of extension. After you have explained how to use the device, present the log sheet to the patient. Remind them the directions for use are at the top of the log sheet. Explain that the log sheet should be annotated after each session. Record extension and flexion numbers at the start of the day and the end of the day for reference the next day. Complete the log sheet with the patient recording the numbers from the first session. Remind the patient to show the daily progress log to their therapist so they can monitor progress. Make sure the delivery ticket is completely filled out. Ask the patient for any missing information. Provide a copy of the delivery ticket if they ask for one. Ask the patient to verify the information on the delivery ticket and then sign it. Give the patient these required documents and explain their purpose. First, present your business card. Then, the directions for use, the client bill of rights, and finally, their HIPAA form. Ask the patient if they have any other questions that you can answer for them now. Then explain the terms of the Easy Stretch rental. This rental is for 30 days and is completely being paid for by the Veterans Administration. During the 30-day rental, someone from our office will be contacting them to make sure that everything is going well with the Easy Stretch and their rehab. If at the end of 30 days the patient feels they can still benefit from using the Easy Stretch, they should let our representative know. Also, ask them to let their doctor or physical therapist know how they're doing, and our representative will work to get their rental renewed. If at the end of 30 days they are doing better and they have completed their therapy, instruct them to let our representative know, and we will arrange for someone to pick up the Easy Stretch. As a courtesy, remind the patient to go to any follow-up doctor visits or physical therapy sessions that may be scheduled. Instruct the patient on how to use the pull pin to remove the top T-bar. Let them perform this task themselves. Don't do it for them. Have the patient reverse the process they used when sitting on the device. Swing the non-affected leg back over the center post while turning their body to a sideways seated position. Have the patient stand up. As you say goodbye, thank the veteran for their service and tell them to have a great day.